Hello everyone, I am urologist Omar Erdamakaya. The subject we will talk about today is stem cell therapy. It is one of the most popular treatments for erectile dysfunction in the last 5 years. How useful is stem cell therapy? To what extent does it correct erectile dysfunction in patients? What should we expect when doing a stem cell treatment? What kind of treatment is it? I will touch on these briefly. Friends, stem cell therapy has been used for the last 5 years to provide tissue regeneration in the penis and accordingly to correct erectile dysfunction. What kind of treatment? Stem cells taken from blood, belly fat or bone marrow are subjected to a certain process. For example, fat is removed, blood is taken. They undergo a certain process. The stem cells are concentrated and injected into the spongy bodies of the penis and waited for a certain period of time. It is a one-time procedure. It is a daily procedure. After the procedure, we send the patient home. The patient continues his daily activities the next day. Such a procedure. What is our expectation here? After transplanting stem cells into the penis, the aim is to ensure the formation of new and healthy stem cells in the cavernous body and to reduce or eliminate the patient's complaints about erection. Is there a standard? Should we take it from belly fat, bone marrow, or blood? There is no standard, friends. In February, a systematic review on stem cell therapy for erectile dysfunction was published. In the Association for Sexual Medicine, one of Europe's prestigious journals. Here 19 studies were discussed. The amount of patients participating in the studies is small. 6 patients, 10 patients, 15 patients. And 2 randomized controlled trials were evaluated. To put it simply, studies with a slightly lower level of evidence in small studies have revealed a positive, therapeutic result regarding stem cell therapy. But there are 2 randomized controlled trials. Randomized controlled trial means that patients are divided into 2 groups. One group is given normal stem cell treatment. One group is given a fake drug. The results of the randomized controlled trial say that the results of the fake drug and stem cell treatment were the same. So it says there was no difference. When we look at small studies, between 50% and 70% of patients have seen a significant benefit after stem cell therapy. So as a result, scientific studies create confusion. But there is also such a fact. Now, the patients to whom we apply stem cell therapy are the group of patients with advanced erectile dysfunction, which is the most difficult to treat. In other words, we do not apply stem cell therapy as a first-line treatment to every patient who comes to the clinic with erectile dysfunction. We can perform stem cell therapy in patients who have not benefited from drug treatment or multi-wave treatment and for whom penile prosthesis is an option. It can really give very positive results in some patients. One of the most frequently asked questions is how long is the duration of effectiveness? Friends, there are patients that I have been following for 1 or 2 years so far. In the studies, the longest study was conducted for 1 year. There are patients whose efficacy continues for 1 year. But we must also accept that if the patient has underlying pathologies, serious problems such as smoking, alcohol, irregular life, malnutrition, if the patient has diseases such as vascular diseases, diabetes that have not been eliminated, of course, we expect the well-being that stem cell therapy will bring to the patient to be temporary. Stem cell therapy is one of the regenerative therapies. It can be done together with shock wave therapy. It can be done together with Botox. Ozonized stem cell therapy can be applied. Of course, these have a cost. Stem cell therapy is now among regenerative therapies. The price can be high according to the preparation applied. When you look at the market, stem cell therapy can start from 20,000 Turkish liras and go up to 100,000 Turkish liras. It can be used in many areas in urology, infertility, erectile dysfunction, Peyronie's disease are examples. In general, this is stem cell therapy. The application is simple, as I said, it is a daily procedure. After taking blood or belly fat from the patient can continue his daily work. If you want to get information about this, you can contact me through the contact line. Thank you for listening, best regards.